Is your period acting unpredictably, turning your life upside down? You're not alone, and your body might be trying to tell you something important. Every woman's cycle is unique, a delicate rhythm that often dictates our daily lives. But when things go off script, when bleeding becomes unpredictable, unusually heavy, or lasts too long, it can be confusing, frustrating, and even a little scary. Today, we're diving deep into a topic that affects countless women worldwide: abnormal uterine bleeding, or AUB. We'll peel back the layers to uncover exactly what it is, why it happens, and most importantly, what you can do about it to get your life back on track. So, what exactly is abnormal uterine bleeding? Think of your normal period as a well-choreographed dance, happening within a predictable range of time, with a certain amount of blood loss. AUB is essentially anything that disrupts this dance. It's a wide umbrella term for any menstrual bleeding that deviates from what's considered normal for you. This could mean bleeding too often, not often enough, lasting too long, or being much heavier than usual. It's a common gynecological complaint, cutting across all ages, from teenagers just starting their cycles to women approaching menopause. The impact isn't just physical. AUB can throw a wrench into your social life, work, and overall sense of well-being, sometimes leaving you feeling isolated and drained. Understanding what's happening and why is the first, most crucial step towards feeling better. Now, for the big question, why does AUB happen? Pinpointing the exact cause can sometimes feel like solving a complex puzzle, but thankfully, medical experts have developed a fantastic system to help make sense of it all. It's called the POM-COEN system, and it categorizes the diverse reasons behind AUB into structural issues, POM, and non-structural issues, COEN. It's not just medical jargon. It's a clear roadmap that helps doctors figure out the root of the problem. Let's break down the POM first. These are the structural issues, meaning there's something physically present in or on the uterus. P stands for polyp. Imagine tiny, soft, finger-like growths inside the lining of your uterus. They're usually benign, meaning not cancerous, but they can cause spotting or irregular bleeding, often like a drip from a leaky faucet. A is for adenomyosis. This one's a bit trickier. Picture the tissue that normally lines your uterus, the endometrium, starting to grow into the muscular wall of the uterus itself. It's like a garden growing where it shouldn't, making the uterus bulky and often leading to heavy, painful periods. L is for leiomyoma, or fibroids. These are probably the most well-known. Fibroids are benign, non-cancerous growths that develop in the wall of the uterus. They can range from the size of a pea to as large as a grapefruit, and depending on their size and location, they can cause heavy bleeding, prolonged periods, and pressure symptoms. M stands for malignancy and hyperplasia. This is the serious one, referring to cancerous or precancerous changes in the uterine lining. While less common, especially in younger women, it's why any persistent abnormal bleeding, especially after menopause, needs to be taken seriously and investigated thoroughly. Moving on to COEN, these are the non-structural causes, often related to how your body functions at a hormonal or cellular level. C is for coagulopathy. This simply means a bleeding disorder. If your blood doesn't clot properly, even a normal menstrual period can become excessively heavy and prolonged. Sometimes these are diagnosed bleeding disorders, but sometimes AUB is the first sign. O is for ovulatory dysfunction. This is a really common one. It happens when your ovaries aren't releasing an egg regularly, or at all. Your hormones, like estrogen and progesterone, get out of balance, leading to unpredictable bleeding, sometimes light, sometimes heavy, sometimes skip periods entirely. Stress, extreme exercise, weight changes, or conditions like polycystic ovary syndrome, POS, can all play a role here. E is for endometrial disorders. This category covers problems directly with the uterine lining that aren't explained by polyps or malignancy. It could be inflammation, infection, or other issues with the tiny blood vessels that control bleeding and clotting within the lining itself. I is for iatrogenic. This term means caused by medical treatment. Certain medications, like blood thinners, or devices, like some types of IUDs, can sometimes lead to abnormal bleeding as a side effect. It's not a fault, just a known potential consequence. N is for not yet classified. This is the we're still learning category. Sometimes, despite thorough investigation, the exact cause remains unknown. But even then, there are still ways to manage the symptoms. So, how do you know if you have AUB? The symptoms are incredibly varied, and this is where many women struggle because they might not realize their experiences fall outside the normal range. Common types of bleeding irregularities include heavy menstrual bleeding, often called menorrhagia. This is more than just needing a heavy-duty pad. It means soaking through pads or tampons every hour for several hours, passing large blood clots, or needing to double up on protection. Prolonged bleeding, also known as menometrorrhagia. Your period might last for more than 7 days, dragging on, making you feel perpetually tired. Bleeding between periods, or metrorrhagia. This is spotting or bleeding when you're not expecting your period at all. It can be particularly unsettling. Infrequent periods, or oligomenorrhea. Your periods come less often than every 35 days, sometimes only a few times a year. Absent periods, or amenorrhea. This is when your periods stop altogether for several months, outside of pregnancy or menopause. The challenge here is that for too long, many women have been told to just deal with it, or that heavy, painful periods are just a part of being a woman. But that's simply not true for everyone, and it often masks an underlying issue that can be treated. Many women might be suffering in silence, normalizing symptoms that are actually quite disruptive and potentially harmful. Living with constant heavy bleeding, for example, can lead to iron deficiency anemia, leaving you perpetually exhausted, dizzy, and short of breath. It can disrupt your work, your social life, and even your self-esteem. The key moment here is realizing that your experience matters and that you deserve to have your concerns heard and investigated. So, if you suspect you might have AUB, how do doctors figure it out? The diagnostic journey usually starts with a thorough conversation. Your doctor will ask you a lot of questions about your menstrual patterns, when your period started, how long they last, how heavy they are, and any other symptoms you experience. Keeping a period diary, even just on your phone, can be incredibly helpful here. They'll also review your general medical history, including any medications you're taking. Next, you'll likely have a physical examination, including a pelvic exam, to check your reproductive organs. This isn't usually comfortable, but it's crucial for ruling out obvious physical issues. Then come the diagnostic tests, which are like detective tools to get a clearer picture of what's happening inside. Blood tests are common. They can check for anemia, hormonal imbalances, like thyroid issues or PCOS, or bleeding disorders. Imaging techniques are also invaluable. A pelvic ultrasound is often the first step, providing a picture of your uterus and ovaries to look for fibroids, polyps, or other abnormalities. Sometimes, a more detailed look is needed, like a hysteroscopy, where a tiny camera is inserted through the cervix into the uterus to directly visualize the lining and remove any polyps or fibroids. In certain cases, especially if malignancy is a concern, an endometrial biopsy might be performed, where a small sample of the uterine lining is taken and sent to a lab for analysis. The whole purpose of these tests is to accurately identify the underlying cause, because that's what guides the treatment. When it comes to treatment for AUB, there's no one-size-fits-all solution. It's a highly tailored approach, carefully chosen based on the specific underlying cause, how severe your symptoms are, and importantly, your reproductive goals. If you're hoping to get pregnant in the future, that will guide decisions differently than if you're done having children. Treatment options range from simple conservative management to surgical interventions. For many women, medical treatments are the first line of defense. Hormonal therapies are often very effective because many AUB cases are rooted in hormonal imbalances. This includes oral contraceptives or birth control pills, which regulate your cycle and reduce bleeding by providing a steady dose of hormones. Progestins, either in pill form or through an injection, can help to thin the uterine lining and reduce bleeding. Hormonal IUDs, like Mirena, release a progestin directly into the uterus, which can dramatically reduce or even stop periods for many women. These therapies work by regulating your menstrual cycle and reducing the amount of bleeding. Beyond hormones, there are also non-hormonal options like tranexamic acid. This medication helps your blood clot more efficiently at the site of bleeding in the uterus, reducing heavy flow during your period without affecting fertility or hormones. If medical treatments aren't enough, or if there's a structural issue like a large fibroid or polyp, surgical interventions might be considered. A hysteroscopy with polypectomy is a minimally invasive procedure to remove polyps directly from the uterine lining. For fibroids, a myomectomy can remove the fibroids while leaving the uterus intact, which is important for women who still want to have children. In severe cases, especially for women who are done with childbearing and have debilitating heavy bleeding that hasn't responded to other treatments, an endometrial ablation might be an option. This procedure destroys the lining of the uterus to reduce or stop bleeding. Finally, the most definitive treatment is a hysterectomy, the surgical removal of the uterus. This is usually reserved for the most severe cases when other treatments have failed or for life-threatening conditions. The importance of early diagnosis and management of AUB cannot be overstated. Ignoring these symptoms can lead to worsening anemia, chronic fatigue, and a significant drop in your quality of life. It's not just about managing the bleeding itself. It's about addressing the underlying medical condition, whatever it may be, to prevent further complications and improve your overall health. You deserve to live free from the burden of unpredictable or excessive bleeding. If your period feels out of control, please don't suffer in silence or dismiss your symptoms as normal. Talk to a healthcare provider. They can help you get evaluated, understand the causes, and find a personalized treatment plan that's right for you. Your body is talking. It's time to listen. To learn more about women's health issues, watch this video next.